Hello everyone and welcome to this session on assessment and recognition of COVID-19 among people with an intellectual disability. In these very uncertain times, we would like to offer you some guidance on COVID-19 to support and help you in your care of an individual with intellectual disability. We appreciate that you have a lot of experience, but we also would like to acknowledge that everyone can't know everything, and in our current situation, things are changing at such a fast rate it could become overwhelming. We hope this learning module will support you and act as a refresher. So whether you're a nurse whose specialty is in autism or a care staff who may not have engaged in clinical skills before, we hope that this session will be of benefit. Just remember, it's okay to be anxious. This learning module will introduce you to the basics. It's focused on the observations and clinical skills you will need to care and support an individual with intellectual disability who may present with symptoms of COVID-19. So welcome everyone, my name is Dr. Ailish Burke. I'm a lecturer in the Intellectual Disability Nursing discipline in the School of Nursing and Midwifery in Trinity College and the Associate Director of the Trinity Centre for Ageing and ID. My colleague, Miss Kathleen Byrne, who developed this module with me, is a clinical tutor in the Intellectual Disability Nursing discipline in the School of Nursing and Midwifery and St James's Hospital. We are both RNIDs with many years of experience and we're delighted to have compiled this resource for you and we hope that you find it useful. We would hope that at the end of this session you would develop an overall understanding of the virus, how it spreads, why people with intellectual disability are at greater risk, recognise the signs and symptoms of the infection, recognise the soft signs associated with intellectual disability, and understand and build your knowledge on the actions to take. These will include general respiratory assessment, positioning of a breathless person, doing vital signs such as pulse, respiration rate and pulse oximetry. You will see why it's important to record these and how to do it. You will also learn how to seek help and advice and to report your findings. First, let me introduce you to some signs and symbols that we use within the presentation. The telephone symbol is to indicate that you contact a doctor. The knowledge check symbol is to indicate there's a question or activity for you to do. An ISBAR is used throughout the presentation. This is a simple method of communicating your concerns about the person to the doctor, and we'll explain that in a little while. So now let's start off and consider the virus. The coronavirus, or COVID-19, is an illness caused by the novel coronavirus called Severe Acute Respiratory Syndrome Coronavirus, SARS-CoV-2. For the most reliant and up-to-date information on the virus, check the HSE website. The virus is very contagious. It's easily spread from person to person, so remember hand hygiene, wash your hands. We must remember that any outbreak of a respiratory illness places a significant risk for people with intellectual disability, and especially those who are older. People with intellectual disability often have underlying conditions that leave them more vulnerable to poor outcomes if they become unwell. Also because people live in close proximity, those in residential and community settings are particularly at risk. Coronavirus is a particular threat to these community members. So let's think about it. Are people with an intellectual disability more at risk? You probably know the answer to this already, but let's review. Anyone who is within an older age group are more prone to underlying health conditions, and individuals with intellectual disability have a higher proportion than those without intellectual disability. As we become older, our immune system becomes weaker and more easily compromised. All the research has shown us that people with intellectual disability experience more health conditions as they grow older than the general population. So many have underlying conditions such as diabetes or heart disease. Also chronic lung problems, they're very prevalent. People with intellectual disability have cognitive issues. That means they may not understand what they're experiencing or what is happening and will need support with this. They often have difficulty in expressing what they want to say, and it might take them longer to express what they want to say, so it's important to give them time. They may have difficulty with personal hygiene and will need support But they will also need support in understanding how to break that chain of infection. There are also a number of people with specific syndromes that leave them more susceptible to respiratory conditions. Others may have particular challenges, such as those with Down syndrome, who may have congenital heart disease that might not have been identified when they were young, or people with Prader-Willi syndrome or cerebral palsy, who are more respiratory compromised and will need closer attention. COVID-19 is transmitted by droplet from an infected person when they sneeze, cough or talk. If it lands on a surface and you touch it, it can easily be picked up. If you touch your face, your eyes or your mouth before you wash your hands, you will transmit it to yourself. That's why it's so easily spread. But remember, it does not infect through the skin, so hand hygiene is very important. So what we need to do is disrupt the spread and break that chain of infection. And you are the most important link in this. You can be the hero in disrupting the spread and saving lives. Remember what you need to do. Basic hygiene. Keep the environment clean. Wipe the door handles, the light switches, the countertops, the worktops. Make sure you adhere to the HSE hand hygiene guidelines. Adhere to the sneezing and coughing etiquette. And don't forget to exercise care when supporting someone in doing their oral health. Be particularly vigilant with this aspect of care, particularly if you're using an electric toothbrush. This sprays. If you have a toothbrush attachment to a suction machine, always use this. Follow the guidelines carefully. Become familiar with the signs and symptoms of the infection. Read the HSE guidelines that are available on the website. Check the website regularly for updates, but remember, this will include new onset of fever of 38 degrees centigrade and a cough which can be dry and hacking. But it can also include other features of common respiratory symptoms. So let's have a look at those. The common respiratory signs of infection include fever, dry cough, sore throat, shortness of breath, breathing difficulties, chest tightness, headache, fatigue, muscle pain, pallor, usually pale or grey, or perhaps a bluish tinge to their lips and fingertips or toes. And this could be an indicator that they're not getting enough oxygen. These are all physical signs that you may observe. However, for people with intellectual disability, you need to be on the lookout for other things. People with intellectual disability can present with more subtle changes, such as changes in their behaviour prior to the onset of a temperature, which is an indicator for this coronavirus illness. So be mindful of soft signs. Be thinking ahead about this before the actual full onset of the virus has taken hold. So think about a person with intellectual disability and their usual personality. They may show lack of interest in their usual activities. They may say no to things that they like to do. Their sleeping pattern may be off. They may look for an extra pillow in bed. They themselves may be recognizing that sitting up helps them breathe easier. They may be anorexic. By that I mean they'll be gone off their food or they're losing their appetite. These are all small but significant idiosyncrasies that may indicate a change for the individual with intellectual disability. Hence, it's important to make sure we don't miss the early start of the illness, and to do that, we need to get the baseline of all the people you care for. By baseline, I mean you need to have everyone's temperature, pulse, respiration rate and blood pressure done and recorded now. This is really important, no matter how strange you think doing a baseline on someone who is healthy and well is. But having the baseline now makes sure that you are able to compare any changes that might arise. So what is a baseline? Well, a baseline is a recording of the person's temperature, pulse, respiration rate and blood pressure. And these are the person's vital signs when they are well. So if their health changes in any way, you will be able to detect the changes earlier and act faster to support them before they become too ill. So let's consider these vital signs a little further. And what we need to do is consider what vital signs are vital. When you say or think about vital signs, you're thinking about temperature, pulse, respiration rate. Vital signs also include blood pressure and oxygen saturation. And that's when someone's oxygen saturation is measured using a pulse oximeter. And we'll talk about that shortly. First, let's look at some considerations when doing the vital signs with somebody with an intellectual disability. So for everyone, we need to make sure before they do any vital signs that the person understands what's going to happen and they're happy to go ahead. The method of taking a person's vital signs is the same as the general population. So make sure that they have rested for 15 minutes, and make sure that they haven't eaten, make sure that they haven't exercised or smoked recently, that they haven't had a hot or cold drink recently, that they're sitting comfortably and they understand what is going to happen. So in taking a person's temperature, you need to consider the following precautions. So check if the person has epilepsy. If so, try to get a forehead scan thermometer or use the ear thermometer, which is safer and avoids any injuries should they have a seizure whilst you're taking their temperature. If the person has pica, which means they have a tendency to eat inedible substances, do not use a Tempedot. If the person has cerebral palsy, they may clench down on an oral thermometer such as the Sure Temp, so it's best to avoid this. Or if the person is prone to ear infection, use the forehead scan thermometer. Overall, if your service has a forehead scan thermometer or the no-touch thermometer, this is the preferred option. With COVID-19 in mind, today we are only going to focus on temperature and respirations, as these are the vital signs that will show changes rapidly with the presence of this virus. We will not be doing any blood pressure or pulse readings. Remember, normal temperature is between 36.5 and 37.5, and normal respiration rate is between 12 and 20 breaths per minute. So we'll examine the temperature first, and then we'll consider respiration rate. So temperature can vary considerably and mean different things. So let's have a look at that. Here you can see different ranges, the different sites you can take the temperature, and what actions you need to instigate should you identify any changes. Any temperature of 35.7 or below is considered low. You must action, keep the person warm, maybe use a space blanket, hydrate with warm drinks, and inform the doctor. If the temperature is within the normal limits, the person is well. If the temperature is slightly high, so the person is starting to present with a fever, so you need to be paying attention to this and tracking it. You need to report this and begin taking the person's vital signs at regular intervals, and the frequency will depend on the initial measurement. You need to be recording it and reporting it, and you need to be following the instructions of your service policy with regard to isolation procedures for a suspected COVID-19 case. Follow the protocol for temperature reducing medications. You need to be informing the GP or the nurse, whichever is appropriate, and you need to use the ISBAR to ensure that you relay the important information that you are concerned about. Now, looking at these examples representing higher fevers, firstly 38.6 to 39.5, an individual has changed considerably. Their temperature is rising very high and they are very unwell. You need to be keeping track of all the vital signs, adhere to your service policy for isolation and medication. The person may need oxygen, check their positioning. If they can sit up, support them to do that so that it will enhance their breathing. And if the temperature rises above that, it's at all of these points you must be informing your GP or nurse. Now here is a sample of a temperature, pulse and respiration chart. They can look different in each service, but the principles of filling them out is the same. So get your temperature, pulse and respiration chart that's used in your service and practice. It looks complicated, but let's break it down. First, make sure you record the person's name, the date and time you start doing the vital signs. Now here you can see from this chart that there's dots and that they're joined by lines. This is how you record the temperature or the pulse. The dots represent the actual temperature, and the lines joining them helps you see at a glance if the temperature or the pulse is going up and down. Also, you can see lines with arrows which indicate the blood pressure. And at the bottom of this chart, there's a small box where you can write in numbers, and this is where the respiration rate is written in. Remember, if you're working with a nurse, they will be able to help you do this. But don't worry, we examine this further and explore it in more depth. We'll also look at an alternative way of doing it. So let's take a closer look. Now remember, in Ireland, we use degrees centigrade for temperature. Now have a look and see, can you read the temperature, which will be the first dot? Follow the light red line across the reading. Have a look at the purple circle. It's the temperature reading. Now the long red box, that's the blood pressure, and the green box indicates the pulse rate. And at the bottom, we have highlighted it in pink, and that's the respiration rate. So get out a pen and paper and see, can you read them and write them down? Try writing them down correctly. Firstly, the temperature, that's highlighted in purple. Then the respiration rate, or the breathing rate, and that's highlighted in pink. Okay, so this is a reminder of the chart. Don't forget to record the person's name, date and time. Don't worry if you didn't get it right. So let's read it. So the temperature was 37.9, blood pressure was 130/84, pulse 78, and the respiration rate was 12. So let's think about another way that you could record this if you find the chart difficult. You can use pencil and paper and create a small table like this one and write down the values for each measurement you do. Don't forget to write down the person's name, the date and time you did the temperature and respiration rate. We'll look at that alternative. So using the table, you can write out the information you need. Take a look here. Write out the name of the person, the time you take the vital signs, and the date, and how often you take them. So you can see over the day how things have changed. So this person's temperature was rising all day until 8 p.m. when it seemed to come down a little bit, but then it spiked again at 12 midnight, but eventually came back down to normal by 4 a.m. You can also see here a reading for SpO2. Now, SpO2 is oxygen saturation, and that indicates how much oxygen is in the person's bloodstream, and we'll discuss this shortly. So we have now read the temperature. Now let's consider the respiration rate, or the person's breathing. So respiration rate is the number of breaths the person takes in 1 minute. So we count the breaths over 1 minute, and that simply involves counting the person's breathing rate when they are at rest. It is the number of times the person breathes in and out. You watch the chest rise for inspiration, the lungs are filling with air, and then the chest falls or decreases as the air is being expelled out. And that's an expiration. So one respiration is an inspiration and an expiration. So it's in and out is one. Just a point to remember. It can be difficult to measure the respiration rate, as the person may alter their breathing if they know that you're being watched. And this can be addressed by techniques such as discreetly counting respiration rates when you're checking the person's, say for example, the pulse. Now take a friend's respiration rate without them knowing. Don't tell them what you are doing, and count their breaths for 1 minute. Remember, what you have to count is the in and the out as one breath. What number did you get? When you are counting the respiration rate, you are also checking the person's overall breathing. You're watching and observing. Is it relaxed and effortless, or is it forced? Is the person straining with their nostrils flaring? This is a sign that the person is having difficulty, maybe in distress. And if they are, they may be in the tripod position. That's leaning over on their hands, with their hands on their knees, and they're struggling to get air in. You will also be watching for the rhythm of the person's breathing. Is it regular and constant with no gaps, Or is it uneven and irregular, which again is a sign that the person is struggling, which could indicate an underlying medical condition such as an infection. And then you're watching and counting the rate. That's the number of the times the person breathes in and out. Have a look at these readings. The normal adult rate is 12 to 20 breaths a minute. An older person can be between 10 and 20 per minute. An abnormal rate can be anything over 25 or under 8, and this can signify the person is deteriorating, and this can happen very quickly. That's why the respiration rate is very important. An abnormal breathing rate can be an indication of an underlying medical condition, and it will need and require treatment. You need to check all the vital signs, support the person to sit up to help them with their breathing, and follow your service policy. Inform the doctor or the nurse, whichever is appropriate to your service, and use the ISBAR tool for doing this. Now, I spoke already about the tripod position, but I would like to show you this and describe it further for you. To maximize lung expansion, so that's to get enough air into the lungs, and especially if the person is in breathing difficulty, a person may take up this position whereby they will lean forward with their hands supporting their upper body. They will use their shoulders, and their effort to breathe is extensive. You can see here in this visual, the man has his shoulders almost up to his ears. He's leaning forward, and you can see his muscles straining around his neck. He's in the tripod position. He's doing this in an attempt to get more oxygen into his lungs. Having good oxygen levels is important for good oxygenation of the blood, and having good oxygen in the blood is vital for your function and the functioning of your organs. To measure the oxygen level, we use what is called a pulse oximeter, which is a small portable device. You can see it here in the visual. It's very easy to use. You place it on a warm finger that has no nail varnish on, and very quickly you can see the reading come up on the digital screen. It will measure how much oxygen is in the blood, and this is expressed as a percentage. So normal oxygen saturation level is between 95 and 100%. If the person's levels are less than this, the first thing you must do is to sit them upright, as this will help them open up their lungs to get more oxygen in, or more air in. The oxygen levels will drop if the person has a lung infection like COVID-19. Have a look at the picture of the probe on your right. Can you read the oxygen saturation level? It's the big number at the very top of the device. It also shows you the person's pulse, and that's the smaller number underneath the oxygen saturation level. Can you read it? Okay, let's have a look and see, did you get it right? Well, did you get it right? The big number at the top of the oxygen saturation level, and in this one is 98%. And as I said, the other handy reading that this device gives you is the pulse rate. So the pulse oximeter on the pulse oximeter, the pulse rate here you can see is 78. So remember, normal oxygen saturation levels are between 95 and 100%. The person is well. But if the oxygen level falls to 94% or less, you need to sit the person up, help them lean forward slightly to help their lungs to get more oxygen in. If they're prescribed oxygen, they would need that, and you must inform the doctor and the nurse using the ISBAR to communicate your concerns. If they're not already on supplemental oxygen, they may need it, so it's time to ring the doctor and the nurse and get help swiftly. Similarly, if their oxygen sats fall below 90, this is a critical emergency. The person is quite ill now, and your actions must be swift. Support their breathing and contact the doctor. All the while, you must remember to adhere to the personal protection guidelines from your service and the HSE if you suspect the presence of COVID-19. So we've looked at the temperature and the respiration, and we have thought about the oxygen saturation. And that starts to put a picture together of the person that is in your care, and are you observing any changes? But we don't look at each of these readings on their own. We must consider them together along with perhaps other signs. And this helps us to build a picture of the person and how things are changing for them. You will be observing the person for other signs. So let's look at other signs that you might see or observe from the person. This is sometimes called how the person presents. So what you want to do is to start putting all these signs together to see a fuller picture of the person and assess their status. So you might observe a flushed face, glassy eyes, rapid breathing, a pulse rate might be elevating, which means it's going up. They may be nauseous or anorexic, they've gone off their food or they don't want to eat. There may be a change in their mental state or they're becoming disorientated. And other symptoms may appear, such as anxiety, exhaustion, their skin colour changing, their face colour changing, or maybe pursed lips in attempt to breathe. You need to stay alert. If someone has an underlying respiratory condition, there could be an acute deterioration of their existing respiratory disease. So what you're doing is you're trying to get the full picture of the person. Now, this is not a new skill for many of us. If you're a mammy or a daddy, you will have said on more than one occasion about your child, he doesn't look right, he's not himself. Now, these are the types of skills you are calling on to use them as you look closely at the person with an intellectual disability. Look at their face and their body. Look at the changes that you're observing and act quickly. There are other less common signs of the COVID-19 or less common signs of or symptoms that have been reported. Loss of smell and taste, although it's down as less common, I am hearing that this is reported more, although it is anecdotal at the moment. But do watch out for runny nose or sniffles, red, watery, inflamed eyes, reduced appetite, nausea, abdominal pain. And then you may see other respiratory symptoms that could be included, such as coughing up phlegm or blood. Okay, so let's review. So if someone presents as being unwell, what will you do? You'll get a general impression of the person. You look, you're observing their breathing. Are they orientated to time and place? You listen to them, watching their breaths, listening to their sounds of their breaths, watching for their verbal and non-verbal cues. You're observing, is there anything out of the ordinary? What does their breathing sound like? Is it noisy? Is there a wheeze? Is there a stridor? And you'll ask the person what their problem is. You're asking them to identify, is there anything particular that they've been in contact with that may have caused this onset? Because you don't want to mix up other conditions that may be presenting. So you are going to assess the situation. So firstly, by taking the baseline of the person's vital signs. This means that even if the person is presenting as well and fit, you will know what their normal range is. So you'll become familiar with that. So if they become unwell, you'll be able to tell very quickly and compare the vital signs to when they were well. And now you'll be able to see these changes and they'll indicate that the person is becoming unwell. We talked about the pulse oximeter. If that's available, definitely you would do that. But if it's not, there is a little assessment that you can carry out called the capillary refill test, CRT. Now, CRT is 5 seconds whereby you press the person's finger until it blanches and then release. It will, within 2 seconds, become pink again, and that indicates that the person's circulation is good. The only thing to remember here is that if the hands are cold, the test won't be as accurate. So make sure you warm up their hands first, maybe by helping them wash their hands in warm water. So overall, when you consider your assessment, hopefully the readings will be normal. If not, you must action, and if in the suspected case of COVID-19, in the presence of COVID-19, you must instigate the services policy in relation to isolation. Remember, the person with an intellectual disability, their changes might be subtle, and you may notice changes in the person's behaviour, and that may be an indication that they're presenting as unwell. If they do present as unwell, here are some things that you can do. You support the person to sit up, at least at a 40-degree angle. Use the pillow to maintain this position if needed. Observe, are they struggling to catch their breath? Are they using their accessory muscles? So are their shoulders being pulled up to their ears? Are they leaning forward to help the oxygen into the lungs? Are they breathing with pursed lips? And this may indicate that they're struggling for breaths. Are they struggling to walk and talk at the same time? Can they finish a sentence with ease? Is the person confused or mixed up? Are they saying strange things? Check the person's mucous membrane colour. It's in the inside of the mouth and or on the eyelids and under their eyelids. This should be nice and pink. Earlier we spoke about sitting them up at an angle. So here you can see this, and this helps them relax their abdominal and tummy muscles and improve their breathing. So for a person who is non-mobile, this upright position alleviates compression of their chest, which allows their breathing to improve. For non-mobile, that's a really good position for non-mobile people. For people who are mobile, the figure here are other ways that you can support them to help relieve their breath. So whether it's standing, leaning on a chair, sitting on the chair upright, bending forward in that tripod position, or being supported in front of a table. Now let's put it all together. So everyone follows physical distancing. Cocoon if you're over 70, and or if you have an underlying health condition. So you're following your HSE guidelines. Do your baseline observations for everyone. If they're all normal, continue with your physical distancing, your hand hygiene, and your regulations in accordance to the HSE guideline. Make sure that your environment is kept clean. Clean the surfaces, door handles and light switches. And nobody will have visitors at the moment. If somebody's baseline is not normal, their temperature is rising and they have a cough, they need to be isolated and you need to inform your GP and nurse. You need to commence regular vital signs and adhere to your service policy in relation to your personal protection. You need to position the person upright and follow your GP or nurse directions with regard to their care. Now that they're in isolation, you need to be considering yourself and your personal protection. And remember that the service user will wear a mask also when receiving care. So you need to be able to support them to understand that. So we've been talking about someone becoming unwell over a few days. You're learning how to recognize these signs and what to do to help the person and when to get help. But what if the person you come across is suddenly ill or they're in a life-threatening situation? I'm now just going to talk about a particular assessment approach that will support you in assessing your situation. It's always vital to know the person's history and underlying issues or any behaviours that might leave them at risk or of sudden deterioration. So things like pica or poor oral or pharyngeal control or dysphagia, these all leave the person at risk of choking and sudden and rapid deterioration. So frequent used process to assess a deteriorating patient is referred to as the ABCD. So the ABCD is a rapid bedside assessment. It will be the initial management of a life-threatening condition, so it doesn't matter what the cause is, the first actions you take to support a person who is rapidly deteriorating is guided by the ABCDE. So A is airway. First, you check the airway. Is it open? Can you hear the breaths going in and out with ease? Can you see the chest rising? The chest will rise and fall is the best indicator for breathing. Can they speak? If this isn't happening, there could be a noisy air entry, and this could be because there may be some obstruction. It could be secretions for the lungs, so suctioning might be needed. So where appropriate, sit the person upright and do a head tilt and chin lift to open the airway. B is for breathing. Look for general signs of distress. Have they effort in their breathing? Are they sweating? Have they blue lips? So you're observing their breathing, um, you're observing the respiration rate, and is the respiration in distress? Is it changing rapidly? Sit the person comfortably upright, support them with pillows. You're counting the respiration rate, and if you have a pulse oximeter, apply it to the end of the finger to get the pulse oxygen saturation rate. And a good reading is between 95 and 100%. C is for circulation. So you are just checking how the person's heart is working. You're doing a rapid assessment. Look at their skin. Are they sweaty or clammy? Check the capillary refill. Remember, press on the finger for 5 seconds till the skin blanches, release. The normal returns to a nice pink colour within 2 seconds. A prolonged capillary refill may indicate poor peripheral perfusion. Feel their hands to determine the peripheral skin temperature. Take their temperature. Is it normal? Are you identifying anything unusual? Then D. D is for disability. So this is assessing, is the person orientated to time and place. You want to make sure you don't assume the person is getting COVID and forget to outrule other things that may be going on. Check the person's neurological status. So what we're really checking for is their alertness. Are they able to respond to spoken word, their voice? So AVPU. If they don't respond to voice, gently shake the person to get a response. And then if they're unresponsive, you must action further. You alert, you get help, you alert, and you contact your nurse or GP. Then the final letter in the ABCDE is E. So you're establishing, has the person any particular evidence of injury, abnormality, rash, swelling or bleeding. You're checking the person overall. What you're doing is you're checking for any kind of injuries. With consideration to COVID-19, you're also thinking about a thorough examination of any kind of contacts that they may have had. So compile a thorough list of all the possible contacts of the individual. So throughout this presentation, we talked about the ISBAR. And the ISBAR is a tool to communicate your message. So good communication is essential for safe patient care. Bad communication can have serious consequences. Throughout the presentation, I referred to ISBAR as the communication framework, and it's one that's used within the HSE to communicate important clinical information, so no information is forgotten or missed. So the ISBAR stands for Identify, Situation, Background, Assessment and Recommendation. And it's a technique it's very simple. It's a way of planning and structuring your communication, and it allows staff an easy and focused way to set expectations of what will be communicated and to ensure they get a timely and appropriate response. It helps to prevent vital information being missed, and it provides a recognised framework within which to organise what you want to say and give the opportunity for you to state what outcome you desire from the conversation. So let's try it out with a scenario. So let's pretend that you're Mary and you have come across John, who has suddenly become short of breath. You've done his vital signs, you've made a note of his history, and you've done your full assessment, and you've positioned him in an upright position, and you contact the doctor. So the first thing is to identify yourself. So you'd make the phone call and say, "Hello, this is Mary. I'm the care staff in Oak Community House. The reason I'm calling is because John Ryan has suddenly become short of breath. His oxygen saturation level is 93%, his respiration rate is 24 a minute, and his pulse is 100, his blood pressure is 110 and over 70, and John's temperature is 38 degrees. John has cerebral palsy and he suffers from epilepsy, which is well controlled with his medication, and if you know his medication, you would include it here. He has been prone to chest infections in the past, so you're giving his past medical history to the doctor. Then you tell the doctor what you have assessed and what you've done. So I've sat him upright, and since repositioning John, his vital signs have improved slightly. His breathing is slightly better, and his oxygen saturation levels are now at 94%, and his respirations have now come down to 20. His pulse is 92. But his temperature is now 38.4 degrees. So then you make your recommendation. You know that John is unwell. This is an unusual presentation for John. So you want to say to your doctor, "Can you come to review John, and have you any further advice for me?" And then you take it from there. So you've given a clear picture of what's happening with John. You've stated your information very succinctly and very clearly to the doctor, and you've told the doctor what action and what support that you need. And that's really important, because you must always remember you are not on your own. So when we think about what we've gone through here, we think about the individuals with intellectual disability and the fact that they are possibly at higher risk. To make sure that we prevent COVID-19 getting into our service and causing infection and causing distress for everyone, we must abide by our HSE guidelines. Wash your hands, but very importantly, teach those you support to wash their hands regularly. Keep your surfaces clean, exercise physical distancing, and exercise good coughing and sneezing etiquette. Understand that people with an intellectual disability could be more susceptible. Know the baseline of your vital signs for those you care for and support, and observe for change, but above all adhere to your HSE guidelines. Record and report. Together, working in partnership with your team and your colleagues, we know we can break this chain of infection. But always remember, you're not on your own. So prevention is the best medicine. And as I said, you as the supporter and carer of an individual with intellectual disability need to help them to understand what to do. So you need to teach them to wash their hands regularly for 20 seconds with soap and water or an alcohol-based hand rub, to cover their nose and mouth carefully when they cough or sneeze and dispose of that tissue and wash your hands again. Avoid close contact. Make sure you're the 2 meters apart. with others, especially if you go out to do your shopping. Grocery stores are quite a dangerous or hazardous place. But above all, for individuals who are very susceptible or are older, they stay at home, they're cocooned, and they self-isolate from others in the household if they feel unwell. Help people understand for the moment that they should not touch their eyes, their nose, or their mouth, especially if their hands are not clean. That at the moment we cannot shake hands, and that can be very difficult for a person with an intellectual disability to understand, especially that they cannot hug people. Again, very challenging. So thank you all for listening. I would like to thank the Office of Nursing and Midwifery Nurse Practice Development, especially Miss Judy Ryan and Miss Joan Dennigan, and the HSE for supporting and collaborating with this endeavour, and the Trinity Centre for Ageing and Intellectual Disability. Do visit our website. We've lots of useful links and information and resources to share with you. Don't forget to visit the HSE website regularly for the most up-to-date information on COVID-19. Thank you very much, and we are delighted, and we hope that you find this information beneficial. Take care and wash your hands.